Well, cervical cancer is caused and spread by a sexually transmitted infection, human papillomavirus. So the best way to avoid it is with sexual abstinence or certainly using condoms, but they are not 100% effective in reducing our risk or preventing cervical cancer. Getting routine screening tests, and also now for girls and women age 11 to 26, there's a cervical cancer vaccine that can actually help prevent some cervical cancers.
So, doctor, what are some of the early symptoms of this cancer that women should look out for?
Well, unfortunately, there are not a lot of early symptoms when the disease is in its very early stages where we'd like to find it. And that's why cervical cancer screening with the pap smear is so important. Typically, symptoms don't develop until the tumor on the cervix is either larger or until the cancer has already spread. So those pap smears are extremely important.
And so how often should a woman maybe be screened?
That's an important question, and one that's really in debate right now because some new recommendations came out from the American College of Obstetrics and Gynecology just this last year. Those haven't been put into practice yet, so the answer may vary from doctor to doctor. Usually it's about every 1 to 2 years, and that depends on the age of the patient and if they've had any abnormal pap smears in the past. So it's very important for each patient to discuss with their gynecologist what their routine screening should be.
All right, Dr. Bazzett, thank you so much for joining us this afternoon. And remember, you can catch more of our on-call segments from your own home computer on WDSU.com.